Tina Burgess worked part-time at the Family Fare grocery store in Byron Center, Michigan for 15 years. She was offered a full-time job, but it started at 5 a.m.
I said, I'm interested in the full-time position, but if I'm going to do the full-time position, there's a few little things, and I just explained to her that I felt that I needed to be home.
As I talked to her about it, that's when she explained to me, I need to still go home and get my kids off to school. And as we talked about it in detail, I told her I don't think there's any reason why we can't work this out somehow.
They did work it out, and Burgess took the full-time job.
Hey, Erin, it's me. It's time to wake up, okay? Okay, bye.
Scheduling flexibility is something Stakowitz and other managers learned through an intervention program that teaches family supportive supervisor behaviors.
We went into 12 stores across Michigan and Ohio, and in half the stores the managers were trained, and half the stores they were not.
We gave supervisors, there were actually cards that contained days where they had to keep track of the number of family supportive supervisor behaviors they engaged in, and these involved interactions with employees.
It was basically a program we did for 3 weeks, and we kept track of how many times we talked to an associate, how many times we asked about their family, or the younger kids, how, sports type things, what they do after school. Hi, Cindy. How's it going? Good. Good.
Stakowitz felt she was already a supportive manager, but keeping track of her interactions helped her improve even more.
I see the difference in these associates once you give them the freedom to know that they can come in and talk and not just come to work and do their job and keep everything inside. It helps.
In the 6 stores where managers received training, the employees reported substantial changes.
It improved their physical health, it improved their reports of general supervisor support, it improved their reports of job satisfaction, so job satisfaction increased, and turnover intentions, the intention to leave the company, decreased.
We learned that small changes to help managers learn how to manage work-family issues have big payoffs for companies.
For Tina Burgess, flexibility made all the difference.
Yeah, I get to leave the store every morning, usually about 7:15, 7:20, and I just come home quick and make sure my kids are up and make their lunch.
Burgess is away for less than an hour. The store has trained other employees to fill in while she's gone.
All right, have a good day. See you when you get home. Love ya.
The store managers found the cooperation goes both ways.
With her knowing that we've accommodated her in her situation, there are times when people are on vacation and she's willing to step up and help me out and go out of her availability because of the flexibility.
They're going to give me that time to be able to go home. I'm going to give them more of my time.
This pilot study was so successful, the Work, Family, and Health Network has started a new study to measure whether this type of training will work in other industries. I'm Mary Sawyers reporting.